We do full bony impacted wisdom teeth. We do simple extractions. The thing that we do in addition to that is prepare for what do we do when the patient's missing a tooth. And so we typically like to reduce the number of invasive procedures. For instance, if a patient has to lose a molar, we have to talk about, well, we're genetically programmed to have it. It comes in when we're 6 or 7 years old. Maybe we should think about putting something back in there. And then we talk about implants and socket preservation. So we'll oftentimes at the time of the tooth extraction recommend doing the bone augmentation and soft tissue augmentation. With the PRF that I spoke a little bit about earlier, we can take some of the patient's own blood and we actually put this in a centrifuge and it prepares the blood clot for the patient already, so it accelerates the healing process, reducing the risk of a dry socket. And the growth factors that are responsible for repairing the surgical wound come from the clot. So if you have no clot, you have no growth factors. So that's why this PRF is such a wonderful development in anybody doing oral surgery. And so what we do is we can place a little plug into the socket, we can mix it with particulate bone graft material and start the process of the surgical wound healing. So at the end of the 3 or 4 month healing period, we have a more robust ridge, something that has a higher composition of bone and consequently will be able to accommodate a nice implant and allow us to get the primary stability that we need so the patient can function with this for many, many years.